Formally, good evening, everyone. Thanks for joining in. Rotary Action Group on Mental Health Initiatives, 35 chapters across the globe and growing. 11 chapters in India, and our District Action Group Mental Health India Initiative 3030 is proud to be the inaugural chapter of RAGMI. DAGMI 3030, as we call it, is honored to lead today's event, and the theme is Workplace Health. A little bit about DAGMI 3030. Have done a global grant project on mental health for schools in Nagpur, training in prevention of depression, diploma in school counseling, free psychological counseling services to a few schools. We also initiated a two-phase first aid depression training program for district officers and Rotarians of the District 3030. Anxiety awareness training program for Rotractors, which is a three-phase program, and several stress management programs for children and adults throughout the district during the COVID period. Just to give you a few statistics, 75 plus total projects done, 50 plus total clubs engaged, 600 plus Rotarians actively participated, 12 inter-district programs, multiple online platform international events with more than 300 up to 400,500 people joining. Mental health awareness competitions, about 6. And whenever we proudly display our work on various booths, 1,500 plus people have visited us. Our webinar outreach is to more than 5,000 Rotarians, 2,000 interactors, 1,400 plus Rotractors, 16,500 plus students, 3,000 plus parents, and 1,000 plus teachers. As Peter Drucker used to say, what cannot be measured cannot be managed. I think the statistics that has been maintained by our chapter are really very promising and motivating both. Globally, an estimated 12 billion working days are lost every year to depression and anxiety at a cost of US $1 trillion. Almost 60% of world population is exposed to workplace, and 60% of that are exposed to mild symptoms of anxiety, depression, and stress. And to make matter a little more worse, 25% of those workplace people meet the threshold for clinically relevant symptoms of anxiety. This is what the World Health Organization's data claims. And that's why today's theme, workplace health, brings in relevance and hope to all of us. We are absolutely thrilled to have our guest of honor today, Bob Anthony. Bob, the chairperson of Rotary Action Group for Mental Health Initiatives. He has a rich corporate experience of 30 years in the technology sector before he decided to work in the ultimate technology, the human brain. Adolescent Wellness Incorporated is a non-profit organization, and Bob contributes to the mental health space through this. His single-line mission, prevent anxiety and depression by promoting wellness resources. They say clarity is power, and this single line that Bob has been able to evolve for himself speaks a lot about his mental clarity as well. As a chair of RAGMI, Bob, through Rotarians in 167 countries, promotes practical programs, break stigmas, raise awareness, and increase capacity for prevention and treatment. We seek your opening remarks, Bob.
Thank you. Thank you so very much. My heart is filled with joy at seeing the achievements that you have made. I first saw the importance of mental health in the workplace when I was visiting India to first facilitate Wellness in a Box with the Rotary Club of Hubli East. My host and driver was past District Governor Basil D'Souza with the Rotary Club of Hubli East in District 3170. He drove me from Goa to Hubli. I had the opportunity to visit schools and hostels in Yellowpore and Mundigad. And I understood why mental health is so important. I saw everyone,
around as well. The last international for Scotland. The most
I saw everyone on the road in India is temporarily insane. It was a moving experience. But seriously, you go to work, you work very hard. It can be a challenge to get through the day, and then it can be a challenge simply to get home again. I've got recent experience with that. I'm having trouble to get back into my own home briefly, but I know it will get better. I'm also very proud to see so many men in this conversation today. The gentlemen, just like the women, have emotions, but I have presented on men and depression. I have personally seen the audience fill and deliver this presentation about men in the workplace with depression. And every single participant in the audience was a woman. We simply couldn't go public with the fact that we had a mental illness, that we had this weakness, because we didn't understand that treatment was available. We didn't understand that there was a path to the other side to wellness. Well, now we know, and we're getting the word out, and I'm so very proud of what you've already achieved in making that happen. I'm also grateful for the work that is being done, not just in India, but here in my home in Florida, in the USA. The Rotary Club of Nagpur in District 3030 sponsored a global grant so that we could train pediatricians here to take care of not only the physical ailments, but the mental ailments of children. And that has doubled the number of pediatricians in our county, Collier County, who will not just screen for anxiety, ADHD, and depression, but actually treat it when it's easy to treat, when a person is younger, without 10 years, 20 years, 30 years of bad habits. So I am thrilled to see the achievements you've already made, and I'm grateful that you've invited me to start your evening on this important conversation. Good night and good work.
Thank you so much. So succinct and so clear. And I love your simplicity, and the kind of joy that you radiate from your face is really, really very contagious, Bob. We'll definitely be crossing roads sometime again. I'm happy to introduce to you Dr. Smita Hantodkar, a dental surgeon by profession, but a mental health awareness volunteer by heart. Even before becoming a part of Dagmi 3030 and serving as the honorary secretary, Dr. Smita was silently working and counseling people, her patients, for dental as well as mental health. She continues to support this noble work through Indian Dental Association, Rotary Club of Amravati, and Rotary Charitable Trusts, Vichakshana Shri Arogya Dham, an extremely difficult word to pronounce. And Smita, I look forward to hear from you about our chief guest and keynote speaker, Dr. Harish Shetty. Please.
Thank you, Satish. Good evening. I am highly privileged to introduce today's keynote speaker, Dr. Harish Shetty, sir. Dr. Harish Shetty, sir, is a very renowned senior psychiatrist from Mumbai, India. Sir has done his MBBS from Nayar Medical College in 1982, his MD Psychiatry in 1986 from KEM Hospital and Seth Gordon Das Sundar Das, that is GS Medical College, Mumbai, and a postgraduate diploma in comparative mythology from Mumbai University. Dr. Harish Shetty, sir, is one of the best psychiatrists from Mumbai, and with the experience of over 3 decades, he is presently practicing at Dr. L.H. Hiranandani Hospital in Powai, Mumbai. Sir is a reputed member of IMA, Indian Medical Association, as well as IPS, Indian Psychiatric Association. He is also on the advisory board on top counseling and wellness centers. Dr. Harish Shetty sir specializes in anger management, depression treatment, suicidal behavior, violent patient management, de-addiction, and many more. In addition to affiliation with multiple hospitals, Dr. Shetty sir has been personally active in many other ways and professionally active in many other ways. Sir has worked tirelessly during COVID. When I came to know about him for the first time, every Sunday and Saturday, I used to listen to him to keep up the mental health of public via online seminars. We welcome the most versatile yet very simple personality, Dr. Harish Shetty sir, as a keynote speaker to this global virtual seminar on account of World Mental Health Day for the theme Workplace Mental Health. Over to you, sir.
So let me start by saying congratulations for holding this workshop. I'm so happy and grateful to all the organizers. Now let us make it very clear. Workplace stress or workplace health is not a vertical entity by itself. It is related to family health. It is related to other aspects of one's nature and other aspects and other influences which really affect the person. So if we really build a vertical institution, which is generally a norm for every symptom, for every issue, and not link it to all the others, then it will be a great problem. Now, when I say this, I would like to say that first thing, I've been speaking to Sangeeta Tai for a long time, that a mental health policy is a must in all organizations. Whether it's a school, college, or even a small NGO, you need to have a mental health policy which is inclusive. Now, what do you mean by mental health policy? Everything is an employee free enough to come and share his mental distress? Is an employee free enough to talk about his wellness and also to share his ideas and wisdom of wellness which he has experienced? If his distress is shared, how does the company, how does the organization treat the distress? Is he excluded? Is he included? Is he seen with compassion? Is he sent to somebody? Is he given enough leave? And when he comes back, is he integrated with compassion and love and also effectivity? Now, when you actually look at that, I finished a draft of the policy, and I will circulate it with all the HRs and other people to get their remarks. Now, some companies in India follow inclusion and diversity. And what is very interesting is these companies also look at mental health when it comes to inclusion. And I'll share you a story. There was one lady who was suffering from schizophrenia, and she was under treatment, and she was doing extremely well. She was absorbed as a personal assistant to an HOD. Everything went off well for 6 months. Still, she stopped the medicine. And when she stopped the medicine, she started writing letters to the HOD, and she was asked to leave. The point is, the company got scared with the entire. They wanted to include, but they got scared. And they had to ask her to leave. What is important is when inclusion is transacted with a mental ill, there has to be protocols laid. For example, if somebody is joined, it's important for her to share that she's on medications. It's important for her to submit herself to evaluation by a panel of doctors or psychologists in the company, so that progress is monitored and he or she is not left alone. On the other hand, there was one male employee who had panic attacks, again included by this beautiful company. They really are sensitive to mental health. And she would bunk all the meetings and move around in malls. And when she was seen actually doing that, she was looked down upon. But what they could have done is looked at whether she gets panic attacks in the meeting and address that panic attack so that she could join the meeting. So just including mental health issues as a policy and making it part of inclusion and diversity is not actually. Well, in a study, a comparative analysis of causes of stress among the employees and its effect among agricultural research and IT sector, these were the findings, and this is very important. for us to see. And the findings were that work overload was a cause for increased stress. Attitude of the boss and the peers were some of the causes. Ambiguity of roles. I'm absorbed for something, but I'm asked to do something else, and I'm not sure what the hell I should be doing. Role overload. I think overload on the role is also one of the important causes. Co-workers causing you a lot of stress. Your team causing you a lot of stress. Career aspirations not fulfilled. There are certain individual factors, physiological factors, climate and philosophy of the organization, behavioral factors, and psychological factors. It's important to understand job control is also one of the most important variables which can affect stress or health of the employee. Well, in another study, workplace stress and coping mechanism in the Indian service industry, we found that elderly employees did much better than young employees, and that's a very heartening thing. But I also feel that there could have been passive coping by older employees where they did not express their views, express their thoughts, express the emotions, and younger employees were more audacious and more open, more candid about how they felt. So what is very important again here is that the communication language, whether in families or in offices, have to be very clear, and it cannot be language which is very condescending, a language that is very curt, crude, and cruel. So I would say that we need to be aware of our feelings. We need to have education of feelings. It's important to talk in the workplace with feeling basis, and that really brings down stress. I really did not like the way you made the presentation. You have missed a lot of points. I can help you improve this presentation. I really was very happy to see that you really worked very hard, and your presentation was very slick. I am delighted that your project report which you made has no flaws at all. There were one or two flaws which actually are corrected. I am very, very sad that in spite of giving you a lot of time, you have not come up with something good. We need to think about it, whether this job is compatible to you or something, or maybe it's not compatible to you. So feeling phrases of joy, anger, sadness, envy, fear, or even affection should be part of the entire communication. Feelings are vehicles for communicating thoughts and communicating beliefs, and also communicating intent in an organization. Now, what is happening? See, we need to understand what is happening in the world. The world is a difficult place. Globalization has its own adverse effects. We have a Honcho who says that we should work 70 hours in India. When he started his career, he was really hitting hard on 9-to-5 jobs. He really vouched for these jobs. That was his belief. But somehow he has changed. The point is, his own companies abroad will not be able to implement the 70 hour. So in an angst-driven world, which India is as of now, with rapid social change, a lot of exciting things happening, a lot of difficult things happening, where mental illness is one out of 7 Indians are mentally ill, where in 8 minutes a young man commits suicide, young man or a woman. In 35 minutes, one student ends his life or ends her life. And in a place where 1 out of 3 people who end their lives are because of family problems, I'm talking about Indian data, NCRB 2022, after that there was no data. So in that context, feelings are generally cooked. And there's a lot of problem in many sectors. It may not be the philosophy of the company, but it could be part of the manager's philosophy, and a lot of adjectives are hurled. Some boardrooms are very violent, aggressive, and it is passed down to the lowest rung in the hierarchy. And when you have these adjectives hurled, which is basically feelings plus judgment is equal to adjective, then what happens is stress increases on those who hold the adjective and those who actually receive the adjective. And beyond that, we also see people who, through a lot of sarcasm, this is your own place. I think you think this is your own place, or whatever sentence I use. But a lot of bosses, a lot of middle level bosses are very harsh. I'll give you an example. I still remember this lady who works in a multinational bank. She had a psychotic episode, and she recovered completely. And she was working in finance. And for her to come back, there has to be some form of a handholding by the HR as well as by his manager. When we communicated this to the HR and the manager, they said it's not her job. She has to work. She has to deliver. Otherwise, she'll be asked to leave. And unfortunately, when she joined, they were very hard. There is nothing doing. This is your deadline. This is your task. You have to finish this in so many hours, in so many days. She could not do it. She got very secondarily anxious. The psychosis did not get worse. She got secondarily anxious, and she just could not finish a task. She had to quit the job and go somewhere else. It so happens that I get a lot of patients from companies. 5 reasons. Number 1, anxiety, depression, and I feel very scared to go to work. Number 2, I did all the work and somebody else took the entire credit. 3, I can't work in this team. I need to be shifted to some other team, and they don't listen. 4, clear-cut depression, clinical depression, which needs to be treated, which may not be only the caused by the workplace stress. And as we actually go ahead, a lot of companies talk about their vision, mission, and welfare, well articulated in beautiful colored posters on the walls of the company. But I ask my psychiatrist, when you go to an organization, ask them 3 questions. What are the work hours? Do you have meetings late at night? Do you send emails or WhatsApp messages after 7 o'clock? Do you demand that he or she has to send some report by midnight? And if that is so, I don't see any vision, I don't see any mission, I don't see any welfare. At the same time, companies offer EAP, Employment Assistance Program, not enough at all. Not enough at all. They need to look beyond. Now, let me share another story. It's important to understand that even if the companies follow all the human rights principles enunciated by ILO or by the law of the land, they need to factor a very important thing that India is in the middle of a mental health epidemic. There will be mental illnesses, there will be suicides. And when they build their emotional defense systems of wellness and illness, they need to factor this. So what is extremely important is you need to look around. Every employee a reporting system. There has to be a system which actually identifies stress very early, or identifies depression very early, or identifies high risk men and women very early, so that they can be actually taken care of. So I always have been speaking about this in organizations, school principals, in IITs, engineering colleges, and all colleges, that frequent mental health checkups are a must. When I mean frequent mental health checkups, I'm not saying we should have frequent mental health camps. Frequent mental health checkups, taking care of GDPR, global issues where you have to really protect the confidentiality of the person. It is easy. Mental health systems are not philosophy. It's not quantum physics, but it has certain key methods by which we can identify early things which are going wrong in the employee. So mental health checkups with utmost confidentiality, global data protection regulation being completely taken care of, and the person told that this is what it is. Can you please go and see a mental professional? It's given a lead to also go and see that he takes care. Now, in this mental checkups, how to break stigma? Somebody was speaking about Bob and others breaking stigma. I would say that the best thing is stigma breaks from the top. It does not break from the bottom. I would like to see the CEO and his wife, or the managing director and his wife, going for the mental checkup openly, publicly. And if they speak about their mental health openly and publicly, things will be very different. And it will give more courage to an average employee to disclose. Well, in India, if you have depression and if you are a pilot, you can't fly. Where in the West, now they have asked pilots to report their depression so that they can be taken care of. They're not thrown out of the job. They could be on medications, but if they report and they are monitored very, very often and continuously, the health can be taken care of. How can you exclude 13% of Indians from workplaces? No, you can't exclude. I'm saying you can't exclude. I'm saying 1 out of 7 Indians are mentally ill, so you can't exclude at all. So mental health checkups, being open about what's happening inside you, and what's happening inside the company is very important. Now, allow me to share my experience here. One experience was when the MD of a company has major depression, he is sensitive to the others and many others, and he refers a lot of people. He does not throw them out, and he takes care of them, and they come back to normal. Again, when a senior vice president is also mentally ill, or he has had a bout of depression, and his peers have been kind and compassionate, he gets well, he comes back, and he becomes a mental ambassador of the company. So in India, it's very strange. It is if something is wrong with me, I can help others. We don't think as systems, and this is very important that we need to think as system and build mental checkups as a part of our activities. Well, there are people the other day I went to a very interesting institution, very big institution. It's an institution of management in the city of Bombay. And the top guy said, well, I don't want you to train my teachers and create awareness of mental health. It's not essential. Right? They are supposed to teach machine learning and other things. They're not supposed to do any mental health work. And if at all I would want to ask, I'll call somebody from Harvard. I had to look at him and say, you are very dismissive about mental health. You're very condescending about mental health. Do your professors who teach in your college are from Harvard? And he got again very furious. But I told him, sir, I understand that you're very intelligent. You have a number of publications. You have worked with machines, but working with machines has made you a machine. And you do not have any empathy, and you do not have any far sight about thinking about mental health. Well, so my experience is you may have the best company and a company with a lot of welfare activities, but when numbers go down, the company starts whipping the employees. All the welfare activities go down, and then the entire philosophy also dies because numbers are important. I still remember in a hospital which had a very powerful welfare policy. When the hospital beds did not get filled, and the top management said, nothing doing, we want numbers, we want money, and we want to see profits. So all welfare activities were thrown to the dogs, and they said, fill the beds, and that's the only way, which is very important. A healthy CEO is something which I think is very important. I still remember I was invited to a very prominent Indian industry office of an Indian industry, and I talked to senior vice presidents, and I found that the company has set their souls and their hearts on fire, and they called me as a fire extinguisher. I said, no, I don't think I'll be able to do much. No, but do something at least. I said, no. If you set fire to the minds and the souls of your employees, and you call me as a fire extinguisher, it will not work. You have to change the philosophy of the company. You have to see how you can optimize their work performance and see that they're healthy continuously. And that would be the best thing to do. When I meet some employees, they say nothing doing, we'll work hard, we'll work long hours, we'll work as long as we want to, because we want to earn money. And if we earn money in 5 years, then I'll retire and I'll be able to enjoy the money for the next 25 years. And I see many employees slogging the butt, not happy, earning 5 to 25 crores per year. And after the 5 years, they do not have the mental health nor the physical health to enjoy the money. So slog now and enjoy later also does not help at all. It's important to understand that optimizing work performance means that you don't have to sit in the company for too long, and that is important. Mindfulness activities, those companies which have a lot of mindfulness activities have made their employees more effective and mentally very healthy in spite of all what is happening around. Now, wellness initiatives have to coexist with illness initiatives, and many companies have a lot of wellness activities. Sangeeta will speak about it in her TCS experience. They have a lot of wellness activities, and TCS is one of the most important companies where welfare is taken care of. And if there is a complaint or a difference of opinion, it is really taken care of with the employee's interest being given a complete priority. Now, this was what I was saying. I don't agree with this man who suddenly feels everybody should work 70 hours a week. I think this has to be really put down and understood in a different context. Now you have some employees, they love to stay in the workplace. They love the cubicle. They hang around till the last person because they have a lot of issues at home. This is a buffer zone for them for their own health. But I see a lot of employees hanging around the cubicle because it's a very nice space. It is green, it is air conditioned, it is beautifully made, it's designed well, much better than the homes, and they have a lot of issues at homes, they have a lot of issues in their relationship, and they love to stay back and work long and work more. But I find most of them are not very productive, and they would do much more work if they stayed for a shorter time. Also, I find that if they would address their issues, they would have a balance between work and home. Now, what is the plan for the future? I would say salaries, equitable salaries. You can't have the salary of a CEO which is 1,000% more than the salary of a manager. I mean, we need to look at this, and there's a lot of debate and discussion over this. You can't have somebody. I see CEOs spending a lot of money on themselves. They've been paid excessively. When the time comes during incentive sharing or during increments and promotion, you find that the HRs sit down and probably give a 5 lakh raise for a vice president, and they would not increase the salary of the managers by even 10 to 15,000. Money improves mental health, apart from everything else. So equitable salaries are important. Then there are toxic bosses. Now they're toxic because of 5 reasons. One, because of stress. I want it now syndrome. I want it now. But they're toxic because of stress, and it has started at a point of time. They have to be addressed. Some people are toxic because of their nature. They are creative psychopaths, and they have to be addressed appropriately by the management. There are some people who are very toxic at certain individuals only. Somehow it's a flashback for them. The individuals they harass, maybe 1 or 2 in the department, they have some memories of similar individuals in their old lives, in earlier lives, and I see them to be extremely toxic. Number 4, those who have lifestyle illnesses are also very toxic, and a lot of toxic bosses almost led to death and suicide of their employees. So many of them have been saved. I still remember this top honcho of a bank boasting, I go home at 5 o'clock. I don't need the phone, the cell phone. I use ordinary phone. I play with my kids at 5 o'clock. I have to tell him straight. You going home at 5 o'clock, playing with your kids at 5 o'clock, you not having a phone does not impress me till your last employee is able to go at 5 o'clock. So all these boastful practices by top honchos in different industries, half of them lie when they are interviewed, and half of them actually harass their employees and make them slog for 12 to 14 hours, 10 to 14 hours, and they go home at 5 o'clock, not acceptable at all. As somebody spoke about stigma, we need to make the narrative of mental health and mental illness very open, and to an extent that we are able to also differentiate the wheat from the chaff, which means if somebody comes and throws a sentence, I'm depressed, I'm suicidal, and the managers get shit scared. They don't touch him with a barge pole. They said, Baba, ye kuch karega, kuch kiya to hamara, if he does something, if he attempts suicide, if he attempts self-harm, I'll be blamed, I'll be responsible, I'll feel guilty. So they don't touch. So we need to understand that people inside the organization should be trained to differentiate the wheat from the stuff. My dear friends, mental health narratives will become very popular. Stigma will slowly go. The CEOs and the MDs are the best people to really break a lot of myths and stigma, and they can be the ambassadors of mental health. Well, we have actors now speaking very openly. So many actors talk about panic attack. Virat Kohli also spoke about panic attack. But then it is good enough. It's very good. But I would say if an MD speaks about it, if a group vice president speaks about it, if a CEO or a CFO says, I took help and I feel nice about it, I'm good as of now, that is the beginning we actually need to make. Well, at the end, I would like to say 3 things. You can view workplace health with 3 prisms. Number 1, looking at the impact which has caused a lot of mental health distress, difficulties and depression or mental illness. You can view it with the prism of the psychopathology and the processes in the workplace. Does the workplace have healthy processes so that the workplace health is enhanced and people are empowered to keep themselves healthy? Number three, changing policies. EAP alone is not enough. Giving access to a phone counselor is not enough. Having a full-fledged mental health center in the organization, it will break stigma. And I would still say that a mental health policy that is inclusive, and it has been proved beyond doubt across the world that inclusive mental policies improve output, improve the health of the entire organization, improves the bonding between employees, and improves general health. And such companies infect others by their behavior, by their policies, and by exactly what they do or what they've evolved across time through the wisdom and the institutional memory which they have really taken care of. With this, I would like to thank you. And that's it.
Lovely. Thank you so much, Dr. Harish. I mean, it was absolutely, you were in such a lovely flow. And all of that came from a lot of wisdom. It was not intelligence alone. And that is something that comes from being there, done that kind of a person. A couple of points that you really mentioned very clearly was all of us understand that bottlenecks are always at the top. And you mentioned that leading from the front, when the top takes this as something that can be seen by people will not be hesitant to do that. That was such a wonderful insight. As Mahatma Gandhi said, that what is ethical today will become legal tomorrow. I think your thought on ensuring that mental health becomes a part of the policy making also within the HR white paper is a great insight. And life is not about this or that. Life is about this and that. And I think creating that right balance was really very important. And looking forward for more support from you, as Rita madam just mentioned, that we would love to see you contributing and helping us to take these mental health initiatives ahead. Thank you very much. Thanks a lot again.
I would like to ask a question, please.
Yeah.
Yeah. So the first question is your last slide, Dr. Shetty. First, let me congratulate you and say it was actually a very brilliant presentation and very insightful. There are a lot of points which have set us thinking, and we will learn more as Sangeeta ji also does her presentation. But your last slide shows Dr. Babasaheb Ambedkar and Shivaji Maharaj. I'm just curious to know why you put these two gentlemen.
They're icons of Maharashtra. I'm speaking in Maharashtra. I love both of them. I've read the history. I've been inspired by Chhatrapati Shivaji Maharaj at the age of 15. When we were playing marbles, he wanted to win a fort and throw Aurangzeb out of the fort. And Babasaheb Ambedkar has been my inspiration for a very long time. In spite of all the trauma, in spite of all the issues which he faced, he still could keep his mind over his shoulder. He was mindful, and he has really been instrumental in building my country as Bharat. I've been to all the places where he has been. He has fought his revolution. I think I also know that it's a Gujarat king who helped him with the funding to go to UK. I've been to the Chaudhar Tala Satyagraha to really feel what must have happened when those untouchables came and said that they have the right to drink water from this lake. So I read history. I read a lot of history. I'm involved with the implementation of the IEP, Indian NEP, where the most important part is building civilizational pride, bringing into schools and helping them know who's Lachit Borphukan, which is the tallest rock statue of like Ellora, who's Birsa Munda, and who are the four Sahibzades, the kids of Guru Gobind Singh. What did Guru Tegh Bahadur do to really bring India, keep India safe and help a large number? So I civilizational pride and understanding Indian civilization is something which I do. So they're all linked. So we do this in schools, among the teachers of preschool and the first, second, third, because impressions are formed between the age of 0 to 12. And I don't like people who denounce my country and say, "यहाँ तो कुछ अच्छा ही नहीं. We are just 70 plus. We have to build a country." So civilizational pride is very important. Civilizational narcissism is very bad. Civilizational doubt leads to a lot of inferiority. So all this is part of the entire journey I'm involved in.
Thank you. Thank you.
I mean,
So brilliant. I think we really need to listen to you more. But I would just like to share one very happy piece of information. And that is when you say that mental health the stigma has to be broken from the top. And perhaps you do know about it, that last year's Rotary International President, Dr. Gordon McNally, in the history of Rotary International, a long history of 119 years, he was the first president who broke the stigma on mental health and championed the cause of mental health as his initiative, as his presidential initiative. So he prioritized mental health all across the world in 200 countries where Rotary exists, with 46,000 clubs and 500 plus districts. And we were fortunate because we are a Rotary action group. Action groups are different from Rotary clubs. I'm sure you know a little bit about the structure of Rotary. Rotary is run by the clubs, and we have 46,000 clubs across the globe. But action groups are focused groups on a particular cause. So we have 25 action groups on water, environment, addiction prevention, and mental health is one of them. And we are the action group on mental health.
I'm
And,
delighted to hear this, and I'm so happy.
We got, because of Dr. Gordon McNally, he's a Scot. He comes from Scotland. And because of him, the mental health agenda got a boost. And all of us as an action group got a tremendous boost only because it came from the top. Whereas from when we formed the Mental Health Action Group in 2015, I'm one of the founding members. We founded it in 2015-16, and it was a long haul. It was a long struggle, and we were struggling to tell people. Of course, there were a lot of Rotarians interested in it. But just to give you an idea, when we talk of statistics, as Satish very illuminates us with statistics, is earlier we were 50 members in the action group. And with Gordon McNally's clarion call for mental health, we are today at 550 members across the world. And we hope to grow. We hope to grow the movement. So it's a movement we are doing among the Rotary clubs.
I want to see more CEOs in India and more Mahindras and Kotaks and others talking the same language, because that would have more impact in the country. And that I think
absolutely. We do look forward to better times ahead.
Thank
you so much.
On the watch, and I'm aware that Dr. Harish wanted to leave a little early. But before you leave, sir, there's a very important information I must tell you, that we are being led as the Dagvi 3030 by our very passionate chair, Rita Agarwalji, who was awarded with the Service Above Self Award and the People of Action Champions of Impact Award this year at Singapore Convention in May 2020.
I can feel that from her sharing, that there's a lot of depth and action in her life, and I'm very optimistic about my country also would benefit from people who are close to being legends. And one of them is the speaker who's going to speak after me. I know it very well. Sangeeta ji has done a lot of mental work inside TCS, and I do not want to stop her now from speaking. I'm really humbled by the presence of Sangeeta ji and a lot of stalwarts here. Thank you, Smita, for inviting me.
I love the way you said it.
Thank you so much. And I suppose Satish is a corporate trainer. He will inculcate and involve mental health in his training also.
It will happen automatically. It will happen automatically. He's absorbing everything and is infected with the fact that I just say one line and I leave. Let us not build vertical institutions. Unless those institutions are linked, then there's no fun. And Satish knows it best. That when you talk about team building, you need to have something more about mental health, etc., etc., etc. So I'm sure that in India, it's all a maze, and we need to work inside the maze, then have tall vertical establishments.
So I will be needing a 1.5 minute more
to
let you know that Rita ji will be taking over from Bob in 1st July 2025 as the RAGMI chair, number one. And number two, one small honor that we would like you to witness is that District 3030 Dagmi, we released a magazine called Mind Matters. This is an e-magazine. It is a signature project of Dagmi 3030, and it's a signature project of Dagmi India as well to spread mental health awareness with 2 lakh plus readership. So we are publishing today the 44th issue based on the theme workplace mental health. May I request Smith Abha to kindly do the honors of e-releasing it in the presence
Yes.
of Dr. Harish Shetty, please.
It's a very short, we are doing it in the video form. It's a very short video.
Please do it.
Rita ma'am is the editor and I am the co-editor along with one more lady, Sri Priya Shaji.
Thank you. Can send me the link, Imprikar ma'am, Abha ma'am.
Yes, sir. Yes, sir. We will be sending you the PDF very soon.
Yeah, and I will read. And thank you guys. I'm sorry, Sangeeta. I'll hear you on the video when they send me the video. But I know that you know it all, and
Oh
you
my
are the
God.
best. You are the best person to talk about this issue. I see it from outside, but I also see it from inside because I interact with a lot of people who are involved in bringing change inside of. Thank you, sir. Thank you.
Thank you, sir.
Thank you so much, Dr. Harish. Having already motivated us to be complete ears for our next speaker, before that, it is important for us to have her introduced, none other than Dr. Bindu Shirsat, an ophthalmologist, a 23-year young Rotarian. She is the chair of Dagmi 3132. This chapter was found taking inspiration from past IRA President Dr. Gordon McKinley and also reading about the wonderful work done by Ragmi. Rotarians and Rotractors in her district chapter have initiated several programs like Project Mindstrong for the youth, counseling centers with the help of psychologists and psychiatrists, Rotarians in the
So
district.
beautiful. So if
Programs.
I have the numbers on my WhatsApp, I'll add you to a list so that they can actually link themselves to parallelly to different groups. I'll be very happy to have the numbers and the coordinates. Thank you, sir. Sangeeta, bye.
So, may I?
Take care, sir. Talk to you soon.
Thank you,
Yeah,
Sangeeta.
so just quickly a word about Dr. Bindu again, moving in continuation, that they have conducted programs for senior citizens to combat loneliness and isolation, programs for prison inmates, corporates, meditation sessions, etc. The keynote speaker, Dr. Rotarian Sangeeta Chandran, is an active member of the District 3132. Dr. Bindu, please let us know a little more about our keynote speaker.
As I leave, please understand that the greatest mental health professionals in the world till today are only 2 Hindu saints. Maharishi Patanjali, who gave us yoga, and Bhagwan Buddha, who gave us Vipassana. I think let us I pay my obeisance to them as I finish. Thank you, sir. Thank you. Bye, everybody. Bye.
Dr. Bindu, can you please do the honors of introducing to us
Yes.
Sangeeta, please?
Yeah, thank you, Satish. So it's my great pleasure to introduce our next speaker, Sangeeta Chandran, who is a renowned safety and well-being expert with over 20 years of experience across various industries. She's the global head of TCS Cares at Tata Consultancy Services, and she has developed groundbreaking initiatives for employee and women's safety, recognized as best practices within the Tata Group and beyond. A certified integrative counseling therapist, Sangeeta also serves as director at the KinderKid Preschool, empowering teachers to foster innovative learning. Her passion for building a better world extends to her roles in CII National Council for Health, Arogya World, Youth Collaborating for Compassion, and developing Project Mindstrong for Rotary Clubs. Founder of Dandelion Talk, an advocacy initiative promoting mental health awareness, Sangeeta is also a trained pilot, car rally enthusiast, writer, and yoga practitioner. inspired by a favorite quote. If you're looking for that one person who has the power to change your life, look in the mirror. Sangeeta embodies empowerment and change. Let's welcome her and hear from her. Over to you, Sangeeta.
Thank you so much, Bindu. And firstly, I just want to say that, I've been searching for, doing some work beyond just the
Sorry to
corporate
interrupt,
work. And
Sangeeta. I think the spotlight needs to go on Sangeeta ji.
can I continue?
Yes.
So, yeah. So, I wanted to do this work, and it is thanks to Dr. Bindu that I'm able to do this because of the fact that, our club is an e-club and can work from anywhere. So while I sit in Mumbai and the club is based in Ahmed Nagar, but still I'm able to do this work, and I'm able to do this work with all of you, which is, again, it's absolutely wonderful. So thank you so much. And, so today I was asked by Dr. Rita and, everybody else to talk about the work that we do at TCS. And I thought I will use this opportunity to talk about a few of the best practices that we have at TCS. And I don't know if I will be able to share my screen. I also sent this presentation to, can you see it? Can you see my screen?
Yes.
Okay,
Yes,
great,
we can.
great.
Make it bigger.
So, make it bigger.
You just have to open the
Multiple slides.
Yeah. Great. So, so basically, at TCS, the mental health initiative, which I head across the world, is called TCS Cares. And I thought I'd talk a little bit about our basic approach to well-being and how mental health integrates with this approach. So firstly, a little bit about TCS for people who might not know TCS well enough. It is India's largest IT company, the world's third largest IT company. The industries that we service range from anything from banking to retail to capital markets to life sciences to manufacturing, public services, energy. You just name any industry and, TCS services it. And the services include IT support services, consulting, cloud services, artificial intelligence, data analytics, cybersecurity, and so many more. You might not know it very often, but you're probably touched by a TCS application or TCS service in the life that we lead on an everyday basis, just like any other Tata product. As you know, the life, Tata products are like across your morning to night and across your life. If you have ever been recently in the last few years to Passport Seva Kendras, you must have experienced the sea change in the way your passports get made now. And that is thanks to TCS, because TCS runs the Passport Seva Kendras in India. We have 6.5 lakh employees across 46 countries. So we are pretty much like a small country ourselves. In fact, if you look at the population of many small countries, we are larger than some of them. And our workforce is very diverse. We have 38% women. 70% of our people are below the age of 30. A large portion of them are now Gen Z as well. So it is a diverse force of culture, language, age, interests, the kind of aspirations people have, the kind of challenges we have. And all this becomes the backdrop for us in terms of what we offer to our people in well-being. So, we look at well-being in a very holistic perspective, and I will not go into all the details which are mentioned here, but just to say that every aspect of well-being, whether it is physical, emotional, social, in terms of safety, in terms of financial well-being, spiritual well-being, so they are all taken care of under our holistic well-being program. And each part of our well-being program sort of overlaps with the other, and we feed off each other so that everything, it is not a sum of 2 + 2 = 4, but 2 + 2 = much more. So that is basically the philosophy, and we believe that we want our TCSers to be fitter, safer, happier. And for this, everybody from our leadership to our HR, to our policies, to our environment, to the way our infrastructure is set up, everything, there is an element of well-being.
சூர்யா சூர்யா தேங்க்ஸ் பார்க்கலாங்க ஆனா சொல்றேங்கண்ணா சரி
And to tell you the importance of well-being at the board level, at every board meeting there is a presentation on safety and well-being for the board as well. So it stems right from the top, and the effort, of course, is to percolate it down right to the bottom to experience it. Like Dr. Shetty was saying, it can start at the top, but it must be felt and it must be experienced right down, and that is always the effort. Our framework, and I spoke a little bit about our diverse number of people, and we collaborate with everybody from HR to D&I teams to our marketing teams to our talent development teams to our social. So every level or every different kind of enabling team is involved in operationalizing well-being, and we provide support through so many different mechanisms, from counselor helplines to doctors to the experts on videos, on chats, on podcasts, webinars, through our welfare team support. So all that gets done. And another part which is very important for an organization of our size and kind is our needs estimation funnel, which basically is to say that we have our ear to the ground at all times to say what is the need right now. So, of course, we have a very well-structured plan and program, which is forms the bedrock of what we do. But it also, whatever is happening in the world, whatever crisis may be happening, whatever issues are happening, this is something that comes to us from, whether it is from the People Connect, whether it is from our safety leaders, whether it is from our emotional health champions, from our managers. So, we really know what is going on, and we try to ensure that people's needs get addressed at that moment in that time. Now, coming to our mental health program, which is what we're talking about today, it is, as I said, it's called TCS Cares, and it is based on 5 pillars, which is just to take you through, as I was saying, the 5 pillars. So we have awareness, understanding, acceptance, and of course in support, which is through all our offerings, and creating a community, which means that basically TCS Cares wants to help you. It wants you to help yourself, and it wants you to help others. So that is the philosophy and the framework for the mental health support program, TCS Cares. And the offerings include everything from professional counseling, and the next slide talks a little bit about that. All our self-help offerings, which are everything from all the webinars, the assessments, the workshops that we do, so all that. And of course, because the manager, the HR, and the leadership are very big part of our penetration and support and philosophy and culture, in ensuring that they are well aligned through sensitizations, through various different programs, through programs which something like a first level, when people become first level managers, they're taken through a special program on empathy, or our senior leadership is taken through another program called Care for Leaders, which I'll talk about a little bit. Here, this is a little bit about our counseling services. And as you can see, I think we all over here, on this call know that in India, there is, the number of mental health professionals for the kind of country, the size of our country is really small. And we looked up the numbers, and it says that there's probably about 1 counselor per 3 lakh people. And at TCS, we have access to more than 450 counselors at any given time through our online or offline or face-to-face model, and which means that we have 1 counselor available for about every 1,000 to 1,100 people. We also have empaneled psychiatrists because we find now that the cases are more complex, and just a counselor support probably sometimes is not enough. So we have psychiatric support as well to provide help to understand any medical advice that needs to be given, any validation that needs to be done. Having said that, I will share with you one challenge, that despite having such a intense offering and ability to give people this kind of help, it is not always that people do reach out, and that is always a journey. and that is always something that we are trying to make sure that people know that this is available to them. It is an EAP service. It is completely external. It is confidential. It is free, and that is something which we are continuously always working towards ensuring that people are aware of that. The next is, this is just quickly a little bit about, how, as I said, we have so many different offerings for our people and for our associates, basically to create awareness around what is mental health, how you can understand yourself. So we also have a web-based training, which is available to all our people. And people can take that to just get a basic understanding. And this is something that, especially when people just join the organization, they are given a list of different web-based training, WBTs as they are called. And, they can go through and they can take the training to understand. Then we have, care peer guides who are volunteers who become like emotional health first aiders who are trained to help people to understand and recognize any signs that they may see within, their environment. So these are people who have regular day jobs. And as you can imagine, within the organization, so many units, so many segments. Like from Mumbai alone, we have 70,000 people, right? So these are people from within the units who have a better understanding of mental health and are able to help people, send them to the right professional if they find that there are people who need that help. Then we have different things like we have Ask the Expert series, we have care stories, we have webinars, we have emotional well-being leaves, which are, so, a lot of organizations, especially startups and things like that, have leaves which are called, no questions asked leaves, right? But at Tata, we are a little more conservative than that. And so we have emotional well-being leaves. But, in this also, if you take more than 3 days of emotional well-being leave, then you, in the system, when you're applying for that leave, you have to put in a certificate from a counselor, because we believe that if you are taking 3 days off for your emotional health and you're not getting help that you need, then maybe, it's not enough. So if you need more time than that, then you must also take that time, but you also get the help that you need. So that is the philosophy behind our emotional well-being leaves. And as I said, our leaders, our HR, all these people, we have sensitizations, we have a program called Notes of Care, which I'll talk about. We have master classes for our leaders to understand different aspects of mental health. And we have the Care for Leaders program, which, I will talk about. I was talking to you about the Care Peer Guide program. So, this is, of course, our emotional health first aider program, which is internal, and it trains people to help people to become better listeners, to understand, to recognize signs, and provide the first level of support, emotional support to co-workers, and help also to create more awareness and, about all the offerings about mental health, and create the last mile reach, which is something that we are always looking to create. This is our Care for Leaders program, and it's a very beautifully structured program. And we run this with another partner, external partner, who, so this is for all our senior leaders. And the need for this was found when, especially during COVID, because we realized that leaders
Sorry
now.
to disturb you again. Someone else
Yeah.
has shared his screen. So
Yes,
please give me a moment. I will try and open the PPT from my end. Please give me a moment.
Should I shut this?
Arvind has started sharing. Who is Arvind?
I don't know. Someone, yeah, even I saw that.
Is Arvind there?
Can we see the screen now?
We can see Sangeeta's.
Yeah.
Should I stop sharing my screen?
Yes, please. Please let me know where to stop.
Next one.
Yeah.
Yeah. So now basically, as I was saying, this is our Care for Leaders program. And after COVID, we found that leaders, the life of leaders has become very complex. The demands on them have become very complex. It is, no longer just about having a team and just telling them what they should do and those things will happen, right? I mean, that world has absolutely changed. And so we felt that it is important for them to have different attributes. And we fitted that in our care attributes, which is C stands for being centered, A is for authenticity, R is for resilience, and E is for developing empathy. So that is how, and we have sessions for workshops and yoga sessions around that. Before that, they take a self-assessment to see where they stand. And after this, and we have an in-house yoga council, at TCS. Because we are so large, I think we can afford to have this, the kind of, support systems. So our yoga council works with us to help after we drive the workshops. They also work with yoga to reinforce the same attributes. Then after the 4 workshops and yoga sessions are over a period of a month, we have something called care nudges, because we find that, in a very busy schedule, you undergo some training, and as soon as the training is over, you forget about it, right? So the nudges are in the form of small reminders to ensure that they remain conscious of their learnings, and through whether it is stories or whether it is through little exercises or anything, and so they remain. And for 3 months we do that. We also provide care coaching for them, and then after 3 months there's a self-assessment which is repeated. And from time to time we also have people from different walks of life coming to share their inspirations and things like that. The program is hugely successful and very well appreciated. And as you can see over here, 87% of our leaders feel that it has helped them with their well-being. And for TCS as an organization, it's really important that they believe that it has actually contributed to their productivity as well. So that is one of our best practices I thought I will share. Ma'am, could you move to the next slide? Next slide, please. Abha, can you move to the next slide?
I'm trying.
Yes. So as I was saying, at TCS, we have people from so many different walks of life and different languages. And, those are such, making sure that people feel met where they are is really important. And we felt that especially for mental health, we all know, like whenever we are very sad or very, very angry or very happy, we always, go back to our mother tongue, right? And so for that reason, we have, we do campaigns like this where we share our resources in the local languages, and just some of them are shown over here, as you can see, in Tamil or in Kannada or in Bengali. And we've done it in 6-7 languages like this, which is shared with if we are sending the mailer to Chennai, it will be sent in Tamil. If we are sending it to Mumbai or Pune, it will be sent in Marathi. So that along with English. So, that was something which we did, and it was very, very well appreciated, and people really felt like it is a program which cares about them. So the effort is always to help people to know that the organization really thinks about them, in all these things. Also, because we're an international organization, our WBT itself is in 5 different languages, including English, Spanish, German, French, Japanese, and, we work on more languages around that. Could you move to the next one, please? Yeah, so we have a initiative called Notes of Care, and the open invitation to everybody over here that if you would like to receive my Notes of Care, please do send me your email ID and I will add you. It's a weekly emailer which is sent out, which basically talks about either through a story or a small sort of a note to remind people of the power of their own humanity. And this is something which probably has one of the highest success rates within the organization. And, so we sent it out to 30K leaders. And, over here, of course, Notes of Care opening rate is mentioned with 55%. And if you're not from a corporate, you might not, understand the value of that. But let me just say that usually any email that we get, the emails that we usually open are those from our bosses or from our clients. And the rest of them are, way down the priority list. But this email, whenever it is sent, literally like within that, the first half of the day, we have 55% people who open the email, and the responses, the reverts from people are, it deeply touches them, and it's a very successful way of ensuring, especially leadership is connected to values, which are really important, so that the ripple effect of that can happen with their people. So Notes of Care is about that. Next one, ma'am. Yes. So, as I was talking, we have so many people, and I'm sure you can understand that, when people are going through a difficult time, we have our EAP service, but what we have is we have a structure for, higher risk cases. And basically the structure is about how, the actions begin to happen the minute somebody is flagged off as high risk or red flag. And in that, the PCS Cares team, the EAP team, the HR, the manager, and the family, and sometimes, any expert that is needed, the welfare team, all these people, they are brought into the loop depending upon, where, how much information needs to be shared, of course, because privacy and data privacy is a very, very highly prized thing at the workplace. And of course, all of you, I don't need to preach to the people who already know that. You all know that the only two times that you can share private information is if a person is at risk, or if a person is going to be committing risk to somebody or harm to somebody else. So we have this protocol, and it is very successful, and we are able to really help a lot of people through this. And the last slide, ma'am. And this is the number. I thought it is a very, I wear this number as a badge of honor, because through the work that we do, these are the number of lives that have been saved in the year, in the time that we have it. And based on the time period that TCS Cares has been there, we find that we have saved, literally like one life is saved per 1.62 days, or almost 2 days. So we believe that that is ultimately the biggest thing that we can do, which is to ensure the final decision of anyone who might be contemplating something with their life, and we are able to save that life. Last slide, ma'am. So basically, I think, Leo Buswell said this, that too often we underestimate the power of a touch, a smile, a kind word, a listening ear, or just the smallest act of caring, all of which has the power to turn a life around. And at TCS, we really believe in this philosophy, and we follow it. And because of that, you will see that, of course, not to say that there are no issues, because people are people everywhere, but there's a very strong culture of care, and issues are looked at very carefully, immediately, with speed, with empathy. And we try to do that. We try to help our people. It shows up in I don't think I need to talk about Tata culture. I think all of you probably know it already, and it shows up in the kind of respect and value that people have for the organization. And with that, thank you very much.
Thank you very much, Sangeeta ma'am. In short, I can say, if Dr. Harish Shetty, of course, he did not scare us, but he mentioned the problem side of it majorly. And what you offered was the solution side, maybe the other side of the coin. What I feel is, all the organizations should adopt these policies. They should come to you, take trainings, and then go back and, with your help, start adopting these policies there. So that will help a lot of people, I guess. So thanks a lot for the wonderful insight. Hello everyone. I'm Dr. Abha Pimprikar. I'm the founder president of DAGMI 3030 and inaugural chapter of RAGMI, and I'm also the co-editor of Mind Matters magazine. So before we move ahead with the panel discussion, I want to inform about our flagship project, the Peer Leadership Program. It is the part of Global Grant Program, Wellness in a Box. And for the Peer Leadership Program, we are focusing on the youth, that is, interactors and rotaractors from Rotary, Also, the non-Rotarian youngsters of this age group can be part of and get benefited with this program. So I will be soon sharing the email ID in the chat box. You might have received our email ID in the flyer as well. So please let us know if you want to have this program in your institute or for a small group of people. Now, moving on, I would like to take the privilege of introducing my co-MOC, Vrinda Varimbe. She's a counselor, psychotherapist. She's a director and chair-elect of DAGMI 3031. And she is a RAGMI director and part of the public image team. Her chapter is doing wonderful projects. The major of the project, major two are they are doing sensitizing psychology students to work in the elderly care center in Pune, that is in India. And they are publishing one magazine which is known as Grey Matters. They publish it quarterly, and Vrunda is the editor for that. And along with that, they are conducting various workshops in school in the field of mental health. So Vrunda, I invite you to introduce Rita Agarwal, who is the moderator for our panel discussion.
Thank you, Abha. And it's my privilege to introduce Rotarian Rita Agarwal to you all. Rita is a senior consultant psychologist at Nagpur City in India and practicing since 1992. She has done MPhil in clinical psychology from Mumbai University. Rita is a columnist in the largest English daily newspaper, Hitavada. Her column, Emotions, is a very popular one till today. Rita is an HR trainer too. In Rotary World, Rita is chair-elect of RAGMI, and she is also editor of a monthly newsletter, Mind Matters. And like Satish has already mentioned, Rita has been awarded with the Service Above Self Award, and also during Rotary Convention in Singapore, she was awarded People of Action Champions of Impact Award in May 2024. Rita will be moderating our panel discussion today. So over to you, Rita.
Thank you. Thank you so much, Vrinda, for that introduction. And thank you so much, Abha, for all the good work that you do for spearheading this program today. So I would like all my panelists to buckle up because we have heard two stalwarts. One is Dr. Harish Sethi, a very renowned psychiatrist who gave his very knowledgeable and wise insights into the problem. And we had heard Mrs. Sangeeta Chandran, the global head of Tata Consultancy Services Wellness Program, and the wonderful, wonderful work that they are doing. In fact, I had lots of questions in my mind to ask her, but because time is short, we are moving ahead with the youngsters. So this program is actually for the youth. After listening to two stalwarts, we now listen to the youth. We have a young panel of 5 youngsters who are young people in the workspace. As we know that India is a very young country. We have about 65% of the population under 35. And of course, we are proud of it. So that means that there is a huge youth population getting into the workforce. And we have to take care of them and they have to take care of themselves. I will invite one by one all of them to speak about themselves. So may I invite Devika Gokhale to introduce herself and tell us what she does, what is the nature of her profession, and what are the general stresses that she faces on the job.
Thank you
Devika.
so much, ma'am. Yeah, thank you so much, ma'am. Good evening to everybody present here. I would begin by introducing myself. My name is Devika Gokhale. I'm 23 years old and I'm a psychologist. Currently, I'm working as a school counselor here at a school in Nagpur, India. And I am required to counsel students, parents, teachers. And along with that, I teach life skills to students of from students of class 2 to class 5, and this is the nature of my work. So coming to the general stressors, since the beginning of this session, we have been talking about the stigma associated with mental health. And that, of course, remains my primary stressor, because being in the field of mental health and talking about mental health issues, I see there is a lot of lack of awareness. And even if there is awareness, there is a lack of acceptance towards it. So that remains the primary stressor. Then, secondly, the subject of mental health issues, life skills not being taken seriously. I see a lot of my colleagues at times, they just say that it is a non-academic subject which does not need so much of attention as compared to the basic mainstream subjects like math, science, social science. So that is another cause of stress to me, that my colleagues don't take my subject seriously enough. Which brings me to my third stressor, which is discrimination based on age and experience. Now, when you work in a school setting, you tend to have colleagues who are there, working from 10 to 12 years with a lot of expertise in the field of teaching. So when you join in as a fresher, instead of, being kind or welcoming, a lot of times you get this attitude from their side that, oh, you are just a beginner, you are just a fresher, you don't know much about this. So you, even if you have opinions, you are taken for granted because you are not old enough, or you don't have that kind of expertise, you don't have that much experience. And lastly, when you are, joining as a young teacher, or you are among the young employees at your workplace, a lot of times you are given a lot of administrative work to do, which is not a part of your job profile, but you're required to do that because you're the youngest and you are expected to help others. That's fine, but as long as your job profile, your area of work is, you know not getting sidelined. But if it is getting sidelined, it is of no use. So these are some of the stressors which I face at my workplace.
Thank you so much, Devika. You have mentioned some very important points. One is age, where you are being discriminated because of your age. And also there is a role ambiguity. So you are given tasks which are not actually your role to play. Thank you so much. May I invite another very young, dynamic panelist, Agastya Munim. Agastya.
Good evening. Good evening, everyone. So, hello, ma'am.
Hello. Put the spotlight on him, please.
Yeah, am I audible, ma'am?
Yeah.
Yeah. Good evening, everyone. So, hello. I am Agastya Muni, an educator and a career counselor who is running a coaching institute from the last 8 years. I'm also the project coordinator director of DAGME. So, as deeply involved in both education and counseling, the main stressor in my work life revolves around managing student expectations, especially when parents pressurize for better scores from students who are already performing at a very low percentage. Additionally, keeping up with constant evolving curricula and balancing administrative tasks with the personal attention each student requires is overwhelming. The fee collection is another sensitive and a very challenging aspect of running the institute. And as our panelist Devika mentioned, being in this field at the age of 27 also raises doubt among parents about my qualification, my experience, given my relative young age. So many associate expertise with this age right now. So they have a lot of experience, 20 to 30 years. So there are many people around who are running an institute at a very, you can say, large, with a lot of amount of years and experience in this institute here. So being an associate with a huge age, which leads to concern about whether the children will be in the safe hands or not. and will they receive proper guidance or not? That actually creates a sense of doubt in the parents here, which is actually a challenging aspect for me too. So ensuring this long-term success of the institute while adapting to new teaching methodologies and technologies also requires concerns, which requires significant time, emotional investment, and also constant efforts here. So these are the things which I am having in my stressor effects, which I have in my work experience here. Thank you.
Thank you so much. Thank you so much, Agastya. We have you have given us some very important points to think over. And please be with us because we will be asking you some more questions. May I call in a very young girl, Sachi Pimprikar, who also will share with us. So we have a list of 5 panelists with us, and please listen to them carefully, what the youth have to say about themselves. Sachi Pimprikar, please.
Thank you. Thank you, ma'am. Good evening, everybody. I'm Sachi, and I'm an artist, educator, and designer. And I create learning experiences to build literacy and life skills through art. And I also use my design degree to kind of do that and plan all the sessions and everything. Moving on to the stressors that I face on a daily basis. One is, as my fellow panelist, Devika and Agastya shared, is discrimination based on age, which I've been facing a lot. Everywhere I go, I am generally the youngest person. So that sort of becomes something that I am discriminated against. And the other one is also very closely connected to that, is gender-based discrimination, which a lot of times, if I am to suggest an idea, it is rejected. But at the same time, if a male colleague comes up with the same idea, it is somehow applauded and put into action. The other one, another stressor that I feel on a daily basis is that I work with a lot of marginalized communities and underprivileged children, and that they come from very difficult domestic lives. And a lot of the sessions that I do, the work that I do with them consists of them sharing these details and talking about their lives. So that kind of becomes a burden on me at times, as much as I love to listen to them and help them. Dealing with the gory details of their lives is also very difficult. Another one also, again, as Devika mentioned, I work in the space of art and design. And so that often is looked down upon, because people think it's a co-curricular activity and that it's not important and it's not a curricular activity. So it doesn't really matter that much, and that people can just snatch my classes away from me and not treat it as importantly as another subject. So yeah, those are the stressors that
Wonderful.
I face.
Thank
Yeah.
you so much.
Thank
You
you.
have added 2-3 more components to it. One is gender discrimination, as well as not being valued. So, of course, we all know that there are professions which can be highly valued, and there are professions which have a low value, and that is all in the mind, because there's nothing like that. We need everybody on this earth to help us in our own way. May I call in the next young panelist who's come from United States of America, Gregor Baum. Gregor, thank you so much
Hello.
for joining us. You have been there with us for the last 2 hours, and thank you
Yes,
so much for joining us. Please maybe have your introduction
of
and
course.
your pointers. Thank you.
Good morning, everyone. Yes, I'm based in the United States, but as you can hear my accent, I'm from Germany, not from the United States. So I want to clarify that. And yes, I'm Gregor Baum. I represent the Rotary District here in 7720. It's in North Carolina. I'm a youth representative of RAMI as well, but my profession is more like an entrepreneur and a writer. I wrote a book, a journal, like a self-help journal, a research with my counselor on campus. And so I appreciate everyone who's counseling here in this room. They do a great job, because without a counselor, I wouldn't be where I am, because I suffered myself on a depression. But anyways, thanks to this counseling, I pushed back through the depression, and I worked on a journal which is implemented in schools across the country and even school districts. So yeah, I run now my own company, which is focusing on coaching and entrepreneurship, where I go to schools and facilitate classes based on life skills, but also about journaling, the importance of breath. So I try to put my resources into the American school systems with already some success in my state. So as an entrepreneur, I think Karan will relate with it because there's another entrepreneur here. The stressors are you are always on the go. It's always on you. If you don't do anything, nothing happens. So I'm constantly 24/7 on my phone, being attentive to mails, trying to find new opportunities to get my resource into new school districts, networking a lot. So networking is my daily activity. And the stressor comes up that I sometimes neglect my own self-care, that I neglect taking time for myself and meditating, doing yoga, going for a walk, leaving my phone behind. It's Sunday today, it's 8 a.m. or it's now 9:30, but I'm still working. So it's hard for me to rest and stop working on something. So I'm like always going. So as an entrepreneur, I think I have to find a way to calm down and take a step back. But then I feel like, oh, how do I grow my business? How do I get my next check? So this is the struggles and perhaps the stressors as an entrepreneur who is hired by himself and has not an employer where you get every check every month the same amount. So it's already looking for new business. So that's my stressor. Thank you.
Thank you so much, Gregor. So it's good to see the young people getting into entrepreneurship right after your graduation. But as you say, both of you who are entrepreneurs or know also what the stress points are, and you have to keep going, and perhaps it's a challenge which we'd love to hear more in the next round. So may I invite a third generation entrepreneur, Karan Jeswani. Welcome, Karan. Let's hear your
Hello,
story.
everyone. Hi. So I'm Karan Jaswani, 29 years of age. Am I audible? Sorry for that. Yes, okay. So I own and manage a clothing store in Nagpur. We have been here since 1961. So I'm the third generation who has been managing this. And the basic stressors which we have in business are usually sale figures. So at the end of the month, if I don't achieve a particular sales figure, it stresses me out because we have a certain amount of fixed expenses that we have to recover. And to sustain and grow my business, I need profits. So that would be the basic stress which I'll have in my life. Apart from this, there is also customer satisfaction. So every time we have people who shop from us, they have to have a very good experience because it is then only possible that they'll visit us the next time. And apart from it, we also have to keep a check on the quality of staff, which are the people who interact with the customers to which we sell to. So they are what the remuneration they require. Are we treating them well and other things related to it? Also, our work timings are not fixed. So we generally start by 10:30, 11 in the morning, and we end up working till 9 or 10 in the night. So that is 10 to 12 hours of work, which takes a toll on your mental and physical health. So I'm still being called out from the background. Sorry for the inconvenience. Okay. And last but not the least, since we are in operation since the past 60 years, I'm the third generation. And as they say, it's the third generation who makes it or breaks it. So there's a pressure of that also. That would be it. Thank you.
Oh, great. Thank you so much. Now, I would come to another round of questions, but you are free to volunteer, whoever wants to answer first. You have talked of the general stresses of your profession on the job, what do you face? But I would like to know what is the personal impact all of you have undergone and how you have managed that. Anybody who'd like to go first, you can just raise your hand and speak. Yep. Oh, do I have to call names? Yeah. Agastya.
Yeah. So I would like to discuss these stresses which impacted me or impacts me usually. So the stressors has actually played a very significant impact on my personal as well as my professional aspect here. So the constant pressure which I face from the students, from the parents, to deliver the unrealistic results, which eventually leads to anxiety. It sometimes leads to frustration here. And it is often difficult to manage such a high expectation when students are starting from a very low academic score. So balancing these demands along with the administration of running a business, like the fee collection process, leads to a mental strain, which affects my focus, which also leads to a loss of uh, energy or energy levels in my uh, daily routine, which actually leads to an impact on how should I be delivering the lectures here. So this doubts, the way we are young right now, and the doubts raised by parents about those qualifications of my young age leads to a feeling of self-doubt. And I need to constantly prove my expertise for that year. So along with the pressure to keep this ever-changing curricula, the teaching methods, it creates a workload, and it also leads to a lot of working hours eventually. So over time, this actually also leads to burnout, impacting my personal as well as my professional aspect. It also leads to hampering in my quality of support which I need to give to my kids constantly or to the students here constantly. So it overall affects my way of delivering the lectures. It affects the way of my routine, and that all creates a stressor effect here in my routine here. That's it. Thank you.
Oh, thank you. Devika.
I would definitely agree with what my fellow panelists just said regarding self-doubt, because when you're working in such an environment, it definitely creates a sense of self-doubt. You actually start questioning yourself if at all you're doing the right thing or not. And secondly, I like to add in this is the lack of motivation. So it's like even if you have new ideas to execute, the work environment doesn't uh, really support you. You don't really feel like implementing or executing your ideas. And lastly, what I would like to add in this is a lot of times you tend to overwork or overdo things just to justify or prove yourself, prove your ideas, because there is nobody to show up for you or show that faith in you that okay, whatever you're doing is right and it is going to make a difference. So just that slight amount of validation also means a lot, especially to us freshers, and that somewhere is definitely missing at my workplace. So yeah.
Oh, thank you so much. I'm really, I feel a lot of empathy for all of you. Sachi, would you share with us if there is any personal impact on you with all these stressors in job place?
Yes. I think the most prominent one has been self-doubt. And it has been, I have gone from being the most bubbly, the most confident college girl to just not being able to speak up in a space, despite working in the space of theater, which is all for talking whenever you want, not being embarrassed at all about anything. And so, yeah, self-doubt has been like a huge dark cloud looming over my head all the time, constantly for the past couple of years, I would say. Another one I think would also be that there has been very little time for self-growth and reflection, where I have not had the time to stop and think about what it is that I really want to do moving forward, not just in terms of my professionalism, but also in terms of what I want to do with my students, because there's just classes back to back to back to back to back, and there's no space to think about what can I do better for them. So that definitely I think affects me personally, my career as well, and it affects the students that I work with. And that also leads to not being able to focus on the actual work because I'm always thinking about what my seniors are thinking about me and whether I'm doing the right thing. Am I doing enough? Am I creating the kind of impact that my organization wants me to create? And last one is that I have really realized I knew about the mind and body connection, but I've never seen it in such an illustrated manner where all my hair is falling out at this age, which is very scary. I put on weight, I have all this acne, and I think that happened. So I recently switched my job. I think that's important for me to mention that I am in a new workspace now. Because of all these issues, I had to look for a new place, a healthier place to work in. And so I'm also seeing the reverse effect of that now. I'm feeling healthier, I'm feeling better physically as well. So yeah, that's both ways I think it goes that.
Yeah.
Yeah.
Thank you so much sharing with us. Gregor, can you share with us your personal impact?
Of course, of course. First of all, I applaud everyone who is vulnerable to share how it affects them, because if they say this work environment and being an entrepreneur or being a teacher is not affecting your mental health or your physical health, I would say that's hard to believe because I see it all the time. If I don't take care of myself, I am super stressed. I get angry with people and I get impatient, especially being always on the go. As I said, an entrepreneur, I have to, as Karen said, make sales, getting into new schools, following up with clients, looking at so how I cope with it is often time to sport. I work out almost 4 to 5 times a week. I meditate every day in the morning. I try to do yoga in the morning every day. So this is how I cope with those stresses, with physical activities, but also with mental activities. And then I try to leave my phone behind. Like I try, not always happening, but I still check messages late at night before going to sleep. But my intention is to leave my phone behind and not going with the work into my bed. So this is a way how I cope with those stresses. But I would encourage to everyone meditation, physical work to get you out of the mind into the body. So, but it's crazy. I'm 25. I feel stressed and impatient. But I think that's the reason if you're 24/7 available, 24/7 thinking about the business and making the next move. So
Yeah.
thank you.
Thank you, Gregor. Karan, would you like to tell us something about your personal impact?
Definitely. So, because of the work timings we have, it takes a toll on your physical as well as mental health. So, there is no space for self-doubt here. Cannot doubt yourself when you have to achieve those sales. You have to be the best. You try to be the best. That would be the correct phrasing. So, when there's not a specific schedule for that, as Gregor mentioned, that you're constantly on the go. So whatever food I intake depends upon the work which I'm doing, at what time I'm doing it. So, it affects your lifestyle. It takes a toll on you. That would be the main issue. So, and apart from that, on a lighter note, I'm sharing this that next month I'm supposed to get married, and my fiance is already complaining that you don't have time for me. That would be it. Thank you.
Oh my God. Okay, I'm so happy to listen to all these youngsters because I've forgotten when I was young. I'm so old now. So please tell us how you manage your mental health, your physical health, and do you have support structures outside? Are your parents helpful? Do you have peer support? What do you do? Please share with us some strategies for how you maintain your physical and mental health. Go ahead. Who would like to start? Devika?
Ma'am, well, for myself, I'll talk for myself. So, on a personal front, I keep telling myself that there are certain things which are going to be out of my control. You have those lists where you write down things which are in your control and things which are out of your control. Because in my work setting, maximum of the work stressors are out of my control. So I just tend to go with the flow, and I tell myself that I'll have to just, focus on things which I'm getting to learn from all of these experiences. And definitely the stressors which are very much in my control, I am working in my full capacity to do whatever I can do to manage that stress level. I definitely have very supportive parents, but I do get certain statements from their side also, that you are a counselor, you should be able to manage your stress. And I tell them that first I'm a human being, after that I'm into the mental health field. So at times even I need someone to talk to, and I need to feel seen, I need to feel heard. So yeah, that is it. And also developing a hobby really helps to just be productive and vent everything out. So yeah.
Wonderful, wonderful. Agastya.
Yeah. So to tackle my stressors, I've implemented few practices, few strategies to create balance and also to reduce pressure. So the first of all is like I need to set apart the clear expectation which the parents need from me here. So I have a proper communication with the parents about what academic goals they are expecting for the respective student here for their current performance here. So if I have a clear expectation about it, I can manage those things. I can make them understand that how can the stressor effect, the major, you can say, the student's expectation can be you can say put down here. Then secondly, the administrative support, like the major concern in an institute, running an institute or a business, is the collection of the funds here, the fee structures, maybe I can say that. So the fee collection process is also a very tired process here. So I've hired some administrative supports here, which can constantly have a catch on that fee collection process, and I can basically focus on my teaching. I can focus on student counseling, and I can also provide constant support to the kids here, thus reducing my workload efficiency. Uh, Secondly, then I have to also build a credibility towards the parents here. So what I do is, as we are at a young age and we don't have a huge qualification here. So what I do is I simply share my success stories with them. I share my testimonials, my data, so that they can have a confidence in what I am capable of doing. Then I showcase my things. And if I regularly update them with whatever the student's progress is going on, constantly keeping a parents teacher meeting can also lead to building up of trust here. So that actually leads to lowering down of a pressure at one end here. Then the way every time the curricula changes here, I need to also keep updating myself. So I need to learn latest teaching methods. I need to go through workshops. I need to go through certifications and courses, which also, on the second hand, improvises my qualification and also builds up confidence in the parents here. It increases the credibility of the of my qualification in the eyes of the parents here. Apart from that, I also take self-care, self-time management here, which actually helps me in establishing a difference between the work and my personal life. So it is actually very important to prevent your burnout. And the way our panelist mentioned, we should be giving us time for relaxation, to carry out our hobbies, to exercise, to perform yoga, or whatever you like, so that you can have a good, healthy work-life balance and you can be better energized here for your task here. And secondly, the connection with the educators, the connection with other professionals here. So the ones who are in my network, the one who are performing the same institute, or who is running an institute along with me, what we have done is we have created a support system with each other, where we usually share ideas with each other. We share what challenges we are facing in our everyday life, and we also exchange ideas with each other, where we tend to find solutions among each other here. so that we can come to a common solution. A common problem is everyone going to face here, but if we have a common solution, we can work out together here. So if you get the right mentorship from the experienced counselors, from the experienced educators here, you are going to get a valuable inputs here. So these are all strategies which
Yeah.
I have implemented in my
Thank you. Thank you.
work life.
That is really insightful
Thank
to
you.
give us all those points. Sachi, over to you. And then Gregor and Karan and
Yes, thank you.
yeah.
One thing is, one very important part of maintaining my sanity has been talking to my mother. Anytime there's something happening in school or in any organization that I'm working with, I know I can just pick up the phone and call her and speak to her and just have somebody that will listen to me and give me advice when I ask for it. So yes, that definitely, my mother and my partner as well have been very supportive and always help me work through my issues. The other thing, and I think it's a very important one, and I would urge, I don't know how many of you have kids, how many of them are in the workforce. I know some of you work with young students. Something that I recently learned to do was speak up for myself, and also realizing that I seen my grandparents, and they were also quite old, and old people can be stubborn sometimes without knowing what their they have something going on in their mind which they cannot necessarily express. So just I also try to be understanding of what my colleagues might be going through. When they see another young person, they might feel like they might miss their youth, and you never know what insecurities they are coming from. So just to kind of speak up and say that, hey, I know what you're trying to say, but this is my idea and this is also my work as much as it is yours. So maybe you could hear me out and we could work away around what both of us want to do. And that had started to help to some extent. But that was also very different. From one person, there was a lot of pushback. From one person, there was a lot of support. So I think it could go either way, but there's definitely, I feel like there's no harm in trying to just speak up and stand up for yourself and say that just because I'm young and just because I'm new to the workforce doesn't mean that everything I'm saying and everything that I want to do needs to be dismissed. So yeah, those are the two very important things that have helped me so far.
Yeah, that's very good points. Gregor?
Yes, so I like what everybody shared. It's also really good points, and I think I can agree with most of them that self-care is an important part, and this is how I take care of myself. Is working out. As I said, what I would suggest for everyone is downtime, giving yourself some time for yourself, time for your family or your partner, going out in nature for a walk. I'm, as I said, big advocate of yoga or physical work because it gets me out of my head when I think about my clients or about business, getting out of my head, and not neglecting my friendship. Sometimes I'm too busy to meet with friends, so sometimes taking out a day to meet with friends and slow down is really important. So you're not super absorbed by work, and work is not everything in your life. There's more than work. There's family, there's friends, there's your body and your own mind. So my suggestion is definitely to get some downtime, but also journaling. I'm a big advocate of journaling since I started my company based around journaling. So I like to journal out or release my mind onto the paper, and then I feel emptier and more happier in my mind. So that's my suggestion.
Wonderful. And thank you. I've seen your journals for kids and for teenagers, and they are just beautiful self-help books. They are absolutely good work that you have done, Gregor. Thank you so much for that. Karan, now this is the last round, and we are well on time as we had planned. Yes, Karan.
Oh,
What do you
yes,
do now
hi.
that you're getting married and you're having a fiance?
So I think most of the panel members have covered everything that is related to release stress. And I'll be on the same terms with them that we need to detach ourselves for some time from our work. we have to take a break. We have to, know our limitations as a human being, that we cannot reach everywhere. There are some things that are not in your control. So we have to accept the fact that, these are our limitations. And also, you can hang out with your friends. A basic sort of physical exercise like taking a walk. I play professional cricket, so that helps me to, completely take off my mind off my work. So yeah, these will be it. And so as I'm speaking for the last time, I would just like to say hi to Sangeeta ma'am. Before joining the business, I was working as an TCS employee for a year and a half. So it's a really good workforce there, and the work culture is also really nice. So hi.
Wonderful, wonderful. Here we have a TCS employee and a
Ex
third
Lovely to
generation
meet you.
entrepreneur.
Lovely to meet you. Always
Yes.
nice to meet TCS.
But ex-TCS, sir. I'm currently law and business
Ex-TCS.
Sure. Yes.
Ex-TCS.
Thank you so much. Wonderful panelists, young ones making a future, making a career, struggling it out, trying to balance the mind, the body, and the external demands and challenges of business and profession. And I would just open it out. If somebody else has a question to ask, the panel is there for you, and I will take a break. Over to the moderator, the MOC, and the public, the audience.
Thank you. Would
Yes,
it okay
Greg.
if I go? If I have like in 5 minutes, I have another call.
Yes, you can
Yeah, and
certainly
Thank
take
you,
it.
everyone.
Thank you.
before
Thank you so
we
much for joining.
Yes, wonderful panel discussion. And before we go to question answers, I would suggest that we go for a formal vote of thanks. So I would like to introduce Saurish to you all. So Saurish, Rotarian Saurish Chowdhury is Director in International Board of Rotary Action Group for Mental Health Initiatives. He is currently serving as Assistant Governor in District 3291. Saurish is advisor for DAGMI 3291. He is founder of Sound and Mind Foundation. And as mental health educator, he works for cancer warriors, autistic persons, and senior citizens. He is certified mindfulness and master life coach. He is also director of International Chess Fellowship of Rotarians. So I would request Saurish to propose formal vote of thanks, and then we can open the forum for question answers to panelists. Saurish, over to you.
Thank you, Brinda ma'am. Thank you so much. Good evening, everyone. So I start with a quote, as my job has been given today, is that, so gratitude unlocks the fullness of life. So what we need to do now is we need to be grateful for what we have today, this evening. We are like festive seasons are going on, so we couldn't get much participants in this particular session, but Ava ma'am, Rita ma'am, this was a great session we could do, and thank you so much for thinking of this and having this today. So I'll start with my heartfelt gratitude to thank the distinguished individuals who contributed their expertise and insights to make this event a resounding success. First and most important, Bob Anthony, Chair, Action Group on Mental Health Initiative, whose vision and dedication drive initiatives that break the barriers surrounding the mental health. And he is a wonderful person because I'm working with him, and he's very, very supportive. And that helps us to, again and again plan for our next action, what we should do. Because doing something on mental health area, any kind of planning, it's really difficult, and wonderfully done by today Ava ma'am, Rita ma'am, and Brinda ma'am. Again and again, I'm saying this is really, really, we appreciate the effort you have given for this particular session. A special note of thanks to Dr. Harish Shetty. He was wonderful, and so much of life he had. It was a real experience for us. And Sangeeta Chandran ma'am from Global Head TCS Wellness. I never knew. I was a corporate employee, but not worked for TCS. And I never knew such a program exists in a corporate world. Thank you so much, ma'am, for sharing, and the impactful words have really ignited, hope and understanding for us, the people who are working for mental health field. And one person who just, at the beginning, she said, I am now getting older. She's actually, age is not just a number for her, because we cannot match her, the kind of energy she has on every field. So I express a heartfelt thanks to Rita Agarwal ma'am, Director Chair-elect 25-26. And wonderfully, you guys can, the panelists, young panelists, you can see the way, she moderates and she handles the kind of topics so nicely. So I'm really, always a big fan of yours, ma'am. And from the very beginning, I'm saying, and thanks to Rotary, I always say this is the opportunity we get if we join Rotary, and we get to know people who are so dynamic, so dedicated, and in return, they're like not looking for anything else. So this is definitely service of ourselves. Thank you so much, ma'am. And appreciation due to our esteemed panelists. 5 panelists we heard, really, really wonderful panelists we had. So Gregor, who joined from US, Sachi, Agastya, Devika, Karan, their voices, resonated deeply and setting the light on workplace mental health. So we could really identify the next generation, like we are the earlier ones. So what exactly they're facing, some of them are really same. So we also face the same kind of, situation we had. So we need to work on this. Thank you so much for opening up, for sharing your, experiences. And most importantly, without these two duo, we couldn't have done this program with our MCs for the evening, Dr. Abha Primpikar ma'am and Rotarian Brinda ma'am. They're like always following up, taking care of things, what we have to do. And most importantly, the technical support. So during this overall, session, we never had any technical glitch. Thank you so much for, your support and help. And one more person who worked really hard is Khushi Agarwal. She was dedicatedly doing the social media posting and the flyer design. So, which really require for this kind of event to bring in people. Without them, we cannot bring people in for these kind of sessions. So really, I am really grateful to her. And overall, we had a lot of chapters who participated, the DAGMI India, different chapters. Rotary Action Group Mental Health Initiative is a wonderful group. The participants here, the audience here, I request everyone to, please go to our website, dragonmentalhealth.org, to find out what exactly we do. And we need more and more people who could, support us to spread this good work, the messages, the awareness, the breaking stigma. There are a lot of work we need to do to, completely change the scenario. So we need each one of you to be part of, this DAGMI or RAGMI, any group. Please join us and participate. That is very, very important. Share the words. Like today's session, I already shared in my Facebook page that TCS first, when she was telling, I immediately said I had no idea about that. And I ask everyone to, go through this. So that is very important. Please, keep sharing. And in last, we had around 40 participants who were really good listeners and really, really very good audience we had. Thank you everyone for taking out time today during the festive season in India. Special thanks to again our US friend. Early morning he joined. Thank you so much. And I have to leave because we have an idle immersion today, so it's going out. So thank you for doing it on time. Thank you everyone. Thank you so much.
Yeah, thank you, Saurish. I would like to extend the vote of thanks to Satish Mandora, our first MOC. Thank you all. Now I declare the forum open, so you all can switch on
Chit-chat.
your videos and have a chat. The panelists are still here. If you have some questions for them, or you have some questions for Rita ma'am, any questions for RAGMI, DAGMI, how to join, whether you want to participate, you want to receive the Mind Matters magazine, the panelist forum is open to all type of communication and questions. Thank you so much.
With all of your permission, can I leave? Because I have to go.
Yeah, certainly.
Yes, certainly. Thank you so
Thank
much.
you so much. Thank you so much.
Yes, Arpita ma'am. Vrinda ma'am, spotlight, you can remove the spotlight from the panelists.
Okay.
So I actually had a question for the young girl who I think she's a teacher, an art and craft teacher, or did I get that wrong?
Sachi.
Yeah,
Yeah.
yes, that's me.
It's very interesting. See, I've been a teacher for more than 40 years. I'm still teaching music. And, I just wanted to know, but isn't it true that in the new education policy, all the co-curriculars have now got spotlights? So what I was asking was, how come that hasn't gone to your place? Because I understand exactly what you're saying. I used to be a music teacher. I trained to be a nursery teacher because of this feeling of, when you walk into the staff room, you sort of not exactly accepted as being one of them. So I understand that perfectly. But what is my question is that the new education policy is supposed to be implemented everywhere. So, how come you still have that problem?
I think, thank you. That's a very important question and a very valid one. So, the implementation of a policy and understanding the policy are two very different things. And that's where the gap is right now. Because the policy has come in, it's this whole thing, right? The management and everybody on top has read the policy. In fact, I even urge parents to read it. I even urge children who can understand to read it. But the teachers themselves sometimes haven't. And so they are kind of doing it just out of, okay, fine, it's there in the policy, so we've got to do it, so we'll put these classes. And then that kind of turns into resentment after a point, because they haven't really understood why that's there. So yeah, I hope that answers your question.
Yeah. I know exactly what you're saying. Thankfully, the school I work in doesn't have that, but I get what you're saying. Yes.
To add to
Okay,
what...
so maybe, all right. I
Yeah.
thought maybe we can call it a day now.
Yeah.
We've all been here.
So to add to what Sachi has said, there is still a little importance given to the curricular subjects, or you can call them, like nowadays we call them as a STEM subject, science, technology, maths, etc. So still more importance is being given to those subjects. So maybe that is also one of the reasons why the NEP is not getting implemented effectively.
Yeah, I agree with you, Abha, because see, we have good policies in place, but what happens to your belief systems? What happens to your values? You still devalue some professions and overvalue some other, so you don't change the mindset. You don't change the mindset. You change the systems, but it takes time to change the mindset. So hats off to Tata, and we just lost him a few days ago, and the whole nation has been mourning the loss of such a great person. He was one of his kind, and the systems he has put in place, what Sangeeta talked about, amazing. We haven't actually heard about it. We'd like to know more about it. So this has been a very good session. And I think we should say bye-bye to each other and meet again sometime.
Yes. Vrinda ma'am, I just request that you don't end the meeting even if everyone else leaves. Let me save the recording, then we will end the meeting.
Okay.
Yeah. Thank you,
We still
everyone.
have work to
You
do.
all can
So
leave.
bye-bye.
We will
Good
see
night.
you back.
Thank you to my dear panelists. I love you all.
Thank you.
Thank you, ma'am.
Thank you.
Thank you.
Bye-bye.
Ma'am,
Take good
Madam
care
Dear,
of
thank you
yourself.
so much.
And we are
Karan,
always there to help you if you need a listening ear.